Welcome to Why Get Vaccinated. This brief learning module will help you understand how being vaccinated against COVID-19 can protect everyone around you, especially your residents. COVID-19 has been a part of our lives for some time now. We know much more about its symptoms, how to treat it, and how to prevent it. We have many more tools in our COVID-19 prevention toolbox now than we did at the start of the pandemic. We know that infection prevention, whether it is full personal protective equipment or masks that are worn in any public space, are essential to prevent the spread of viruses. Having access to COVID-19 tests and administering them or taking them as soon as illness is suspected is key to preventing the spread of the virus. And we know that vaccines are readily available and are very effective at preventing hospitalizations due to COVID-19. There are many benefits of the COVID-19 vaccine. Being up to date on COVID-19 vaccinations can lower your risk of getting and spreading the virus. Vaccines can also help prevent serious illness and death. This is especially important for your residents who depend on you to help them and care for them every day. There are other benefits of getting the COVID-19 vaccine. In addition to protection from being sick, for your residents, in-person visits with family and friends are much safer if everyone is vaccinated. Also, if you are vaccinated, there's less chance you'll need to take time off of work due to illness or a need to quarantine. You are considered fully vaccinated 2 weeks after you receive the last dose in the series. That may be 1 dose or 2, depending on the vaccine manufacturer. COVID-19 vaccines have proven to be very effective at preventing COVID-19, but the protection decreases a little over time. So even if you have received all of your doses, the CDC recommends that people over age 12 get an additional shot, also called a booster. You are considered up to date on COVID-19 vaccination if you received all of the recommended doses in the primary series of vaccines, as well as any booster doses you are eligible for. Because new versions of the virus or variants are likely, you may still need regular COVID-19 tests, even if you are up to date on COVID-19 vaccines. The good news is the vaccine can offer protection against new variants, so even if you should test positive, you should be less sick. There is a lot of information out there about vaccines, and it may be confusing to sort through it all to try and make the best decision for yourself. You may have specific questions and concerns, which is understandable. Talk to a trusted medical professional like your nursing home's medical director or your family doctor. Talk to friends and coworkers who are already vaccinated to hear their stories about why they chose the vaccine and what their experiences were like. Or discuss any concerns with your supervisor. Now let's review a few key points. Think about the best answer for each of the following questions. What are some benefits of being vaccinated against COVID-19? Being vaccinated offers protection from the virus. It allows nursing home residents to have safer in-person visits, and it helps you save your time off from work. What are 3 tools in our COVID-19 prevention toolbox? To protect us, our loved ones, and the residents who depend on us every day, we can use infection control practices, COVID-19 testing, and vaccines. Getting vaccinated is the simplest thing you can do to protect yourself and others. You have learned about the COVID-19 vaccine and what to do if you have any questions or concerns. Keep your COVID-19 prevention toolbox full so that we can all be better protected. You have completed this learning module. We hope you have learned why it is important to be up to date on COVID-19 vaccinations. Learn more. Visit the Agency for Healthcare Research and Quality's website for free tools to help you identify and treat COVID-19.